care, though, is not covered by any insurance, except if you have a long-term care insurance policy, and then it may be, but every policy is different. Sometimes the coverage is only there if they're in a facility and not in home, or they'll pay less for in-home care than they will for somebody in the facility.
My name is Sunhee Yoon. I'm the owner and founder of Sage Lifestyle Concierge. Let's start by clarifying the foundational differences in home care, Maureen. Our first panelist here, Maureen, will shed a light on the distinctions between skilled and custodial care, which is crucial. How we find what kind of services are available and how they might be paid for.
Thank you. Hello, everybody. So basically, skilled care, I'll start with that. That involves medical care provided by licensed professionals. So we're talking about registered nurses, physical therapists, occupational therapists, and it has to be deemed medically necessary to be covered by Medicare or Medicaid or even commercial insurance for younger people. Coverage is dependent often, depending on what type of insurance they have, whether it's an HMO or a PPO. HMOs, you always have to stay in network, so that's always the first step. But the treatment focus is actually either rehabilitation or medical management of certain conditions. They're recovering from some type of illness, injury, or surgery. And Medicare requires the person be homebound, and that means it would be a hardship for them to get out of their home, wherever their home is. It could be a facility, it could be their own house or condo. And so, but they are allowed to go out, like for doctor's appointments. And usually, even that, they need assistance to get to those appointments. So what are some conditions people might have that are actually qualified for skilled care? Maybe they have congestive heart failure and they've just come out of the hospital yet again. Or they're recovering from a stroke, and so they're getting that in-home rehabilitation, right? Nurses assess them, and they may be getting some nursing visits, but they're probably getting some physical therapy in the home. A lot of people have hip and knee replacements, right, as they age, very common. Or it may be somebody that temporarily needs some intravenous or IV medications, or they've got wound care that requires, nursing assessment, nursing care. Or they have an indwelling catheter, and so once a month those need to be replaced. So those are considered skilled, okay? They're getting medical management, medical care. Now, custodial care means they might need some help with activities of daily living. Maybe they have dementia. Maybe they've had a stroke and they're at their capacity, okay? They're not going to return to what their baseline was before it, and they're at their baseline. So they might need help bathing or dressing or eating or toileting and mobility, if they're even able to still walk, help with ambulation, help with transferring from the bed to a chair or the chair to the toilet. And so this is considered custodial care. Is it important? Are they going to survive without it? No. But it's not considered skilled because it doesn't require a medical licensed professional to do that care. They also might need help with meal prep or housekeeping. So this is where you're going to use agencies, hopefully. Now, some people hire people they know to do it. The risk with that, though, is that if something happens to the caregiver, that person that's hired them is going to be responsible for workers' comp. And so you could, maybe nothing will happen, but you can't guarantee that. Whereas if you hire an agency, they have that insurance for their employees.